So access to healthcare is a matter of life and death for rural residents in the Buffalo City Metro. In the Tshabo Village between East London and Qonce, the struggle to get to the nearest clinic means many patients are on chronic medication for diabetes, hypertension and HIV are forced to default. For the elderly and those with limited mobility, the situation is dire. Newzroom Afrika's Sipha Kema has more on that story.
For residents like Nonyameko Simandla, a trip to the clinic is an exhausting and costly ordeal. Without a car, she and others must walk up to 3 hours to reach the nearest healthcare facility. Her second option healthcare facility costs her a 40 Rand round trip for a taxi. She leaves home at dawn and returns long after midday.
Le clinic yethu ke noba umgama wokusuka apha ukuhamba ngeenyawo ukusuka kule ndawo ndihle kuyo apha eTshabo 1 noba about 3 hours ukuya pha ngeenyawo. So kube khona ke ngoku ixesha loba mhlawumbe ube nayo ezo sentanyana uyaqonda. So ufuneka ukhwele uba ukhwele ngo6 ube uleqa u9 uyaqonda mhlawumbe ufika phana ngabo 8 okanye 7 uyaqonda uzawufika apho uhlale uzawusuka pha futhi usuka phana kwakona uzofika ngo2 endlini okubumke ngo6 kusasa ibabetha kakhulu sisi ingakumbe aba bantu badala abakwazi uzihambela ngenyawo ngaba kaloku bahoye nabantu nabazukulwana babo ngezimali zabo zegrant so kubanzima ke ngokuba umuntu abheke eclinic.
For Mamqadi Tomose, a 66-year-old hypertension patient, missing treatment appointments has become unavoidable. With transport only available in the mornings, she often has to walk back through bushes despite her age.
Siyasokola sisi ngokwekliniki apha eTshabo. Ikliniki yethu ikude ipha ngaphesheya kaba uyakhwela xa uyakhona. Ngenye ixesha singabi nazo imali zokhwela ukuya phayana. Ibonakale ke ngoku idate yakho uyitsiba mhlawumbi idate yakho ifike ngale mini ungenamali ngayo. Xana uthe waya ekliniki ufumana into yokhwela xa uyayo. Xa ubuya akufumani into yokhwela sihamba ematyholweni.
The situation is even harder for Vuyelwa Wuqu, a stroke survivor dependent on crutches and a hypertension and diabetes patient. She explains how a lack of accessible transport and distant clinics often force her to leave home in the early hours, only to return after dark.
Siyasokola kakhulu ngongazenzisi umuntu asekhaya sisokola ka iambulance osithatha kula tube sikude indlela zethu zimbi hayi siyasokola kunzima nyani umuntu ubhubhe lapha edlanzeni nisambambile kunzima ikliniki zikude.
Non-profit organizations like Beyond Zero are stepping in where they can, providing mobile clinics to bring essential services closer to rural communities.
It plays a major role, more especially when it comes to TB, that you'll have people that do not come to the facilities and do not adhere to their treatment, not because they don't want to, most of the time, it's because of the distance. We take services to the communities. We've got like your mobile clinics, so we'll have where you will have like your entire biomedical team, which is a professional nurse, and so on. So those people, they go to the facilities, to the communities, and then they provide people in their respective communities in terms of now the biomedical health and all that.
The Department of Health says mobile clinics are a key solution to the lack of fixed healthcare facilities in the rural areas and acknowledges the difficulty residents face.
We can confirm that the department is aware that some people end up having to walk longer distances than they are supposed to in order for them to get to primary healthcare services. The department is equally worried about this, but this is something that is being addressed because the department has embarked on a program of ensuring that we buy as much mobile clinics as possible, so that where there are no fixed infrastructure buildings, we will be able to service the communities.
Despite these efforts, many rural residents still risk their health because of circumstances beyond their control. The distance, cost, and lack of transport mean some go without life-saving treatment, not by choice, but by circumstance. For Newzroom Afrika on Channel 405, I'm Sipha Kema in the Buffalo City Metro.